And we are live. A very good noon to you all, and welcome back to episode 33 of Instagram Live Guest Talk with Homeopathy Heals. Hi everyone. I hope you're doing fine, well, peaceful, loving. Today's episode is very special and very close to me because the guest of honor today is, our very favorite author, and I must say memer, who has just started making lovely reels as well. So hi all, hi, so good to see you all here. So let's add him without wasting any minute. I must tell you about today's session and directly join the live because it is requested by boss that you can come live and ask him questions. I have few list of attendees who will be coming live with us and asking questions. Hello, very good morning. Please accept the request, boss. I am fine. I am fine. Thank you so much for the concern. I'm doing good. Hello, fights. I hope you are fighting well. Hope you are fights. Very good noon, boss.
Hello.
Am I audible?
Yes, yes. Hello, how are
Okay.
you?
Yes. I'm so good. Pretty good. You are here, so I'm absolutely fine now. Okay. So before we start the session, I'm very, very, very damn sure that I don't think barely any student, any homeopath who is not knowing about you. But still, as a ritual, I must tell all the viewers, he is none other than Dr. Rohit Deshpande, and he is a practicing, a very flourished practitioner in Nasik, and he's been known for his, exact diagnosis of the case. Uh, Recently he has published 4 books, and I'm sure you might be knowing his first book was Clinical Comparative Materia Medica, and in which he has compared all drugs from all the sciences, all the across the system. He has also wrote about therapeutics on ophthalmology, on gynecology, and recently his therapeutics of obstetrics has published. And if you want to order either of his book, you can find it on Amazon, or you can connect to Homeopathic Junction. So a very, very warm welcome to you, boss. Yeah.
Thank you. Thank you.
So finally, you're here, and we are here to have a casual talks.
Yes, yes.
So my first question to you is, do you came to homeopathy by choice or by chance?
Honestly speaking, I wanted to become a doctor. I had interest in biology and I hated maths. But somehow I was not able to get admission in MBBS. So I took admission in homeopathy.
That's a very honest answer. Okay. So how many years you've been practicing, boss?
13 years.
13 years you're
Yes,
practicing. Okay.
yes.
So from a practitioner to an author, and recently in 2 years you have published 4 books, which is really a huge number. At times it takes whole life to publish a book. So can you tell us about your journey as an author?
See, while I was student, I used to read many books on homeopathy, textbooks also, and uh, some books out of syllabus also, like Dr. Rajan Sankaran sir's books, Predictive Homeopathy School books, other books. I was very inspired by these books, and I always wanted to write books when I was in BHMS as a student. But I knew that it should have a clinical ground. I should have real experience of treating patients, because in homeopathy too there are so many schools of thought. Each and every school has a different point of view to solve the cases, and they all are true because they are having the experience of treating in that way. So I wanted to experiment each and every school in my own practice, and then to create my own way, and then to write the books. So for 10 years I focused on my clinic, my patients, and after 10 years, then I said it is time to write books now. I had a clinical data already of more than 15,000 patients. So now I had to do a retrospective study and to create a books which were useful, which I needed as a student. When I was student, and I wanted therapeutic books which were very simple, easy to use, and had practical applicability too. So I decided to write books, and first book was a little different, Clinical Comparative Mathematics. I wanted to do something different, so I started with that book, then therapist books.
Okay. My next question is was recently, we used to see about your post and your books and all. Recently, you have started making reels. So I just want to know how people they are responding. Matlab, with what are their reaction
Yes.
to your reels?
About reels, I want to say that I always love to do acting. When I was student, I used to do acting of teachers, maybe the teachers, and I was so famous in college that teachers used to ask me to do acting of other teachers. So I always loved to do acting. And see, I will tell you one experience. Means yesterday, while taking breakfast, my dad saw my reels and he said, "See, the reels are very nice, comedy, entertaining, but you are a doctor, author, and are you really supposed to do reels? Or mean, is this going with your image of being a author?" Or so I told him, this is the reason I'm doing this. I don't want the serious, typical image. I want to break the stereotypes. I'm one of the student. I belong to the students. I'm not something different than students. I'm not great. And there is always a barrier which I saw in between students and authors. As a student, I found most of authors were very unapproachable.
Your
Social
voice is
media was
breaking, boss.
not
Your voice is breaking. Your voice
so
is
much
not clear.
popular at that time, but even now,
Okay. Yes, I'm trying to reconnect. I've sent the request.
Hello,
Yes, hello. Please introduce yourself.
my name Umesh.
Yes, ask your question,
मैडम
please.
Hello,
हमें उसका कुछ है क्या
am
मैडम?
I audible now?
हेयर लॉस
Boss,
Yes.
answer. See, alopecia is of two kinds, male pattern and female pattern. So if it is androgenic alopecia, a male pattern जो baldness होती है, so it is, homeopathy has barely any scope in that. And females, estrogen hormone की वजह से bald नहीं होते. So if it is of females और न्यूट्रिशनल डेफिशिएंसी की वजह से है, so definitely it can be cured. लेकिन एंड्रोजेनिक है तो वेरी सॉरी, इसका कोई ऐसा पुख्ता इलाज नहीं. देयर आर
मैंने
अदर हायर ट्रीटमेंट्स.
मैंने होम्योपैथी में पढ़ा था, रेमेडीज में मर्ज है तो इलाज है.
हाँ, लेकिन लिमिटेशन भी है.
फिर भी मैंने जो पढ़ा, एक्चुअली मैं भी रेफर करता रहता हूँ होम्योपैथी, तो उसमें मैंने पढ़ा
ओके,
था मर्ज है तो इलाज है. यदि कुछ प्रॉब्लम है तो उसका इलाज तो है.
बिल्कुल है, लेकिन सर एक लिमिटेशन है. होम्योपैथी साइंस है और साइंस की भी एक सीमा होती है, और हम अपने लिमिटेशंस को जितना जल्दी समझ लें उतना अच्छा है. एक सही क्योर ट्रीटमेंट में और एक मार्केटिंग बिजनेस गिमिक में फर्क होता है. आप मेरी बात समझ रहे हैं? एक सच होता है और एक बिजनेस होता है, मार्केट होता है.
तो सही बात है.
सो अगर एंड्रोजेनिक एलोपेशिया है, हार्मोनल मेल हार्मोनल इम्बैलेंस की वजह से बाल झड़ गए हैं, बालों में स्कैरिंग हो गई है, मतलब बाल रूट से निकल आए हैं, उसका इलाज संभव नहीं है मेरी नजर में.
जी जी.
कोई अगर आपको कहता है ये करने से वो करने से बाल उगाएंगे, तो सिर्फ मार्केटिंग स्ट्रेटेजी. इस चीज को समझना चाहिए.
और इसके विटामिन वगैरह के लिए कुछ ऐसा होम्योपैथी में
मतलब
कोई, मतलब
yes boss, audible?
Yes. Am I audible now?
Yes. Yes. So I was asking you about your making your reels, and that was very apt answer to break the stereotype. मुझे भी ऐसा लगता है कि शुरुआत खुद से ही होनी चाहिए. और being a doctor, तो हम लोगों के लिए इतना प्रेशर रहता है, ऐसे कपड़े मत पहनो, वहां मत जाओ, दोस्तों में मत जाओ, ऐसा बाहर का खाना मत खाओ, इतना जोर से मत हंसो, लोग क्या कहेंगे, आप डॉक्टर हैं, आप ऐसे नहीं कर सकते. सो आई कंप्लीटली अग्री विद यू के स्टीरियोटाइप भी हमें ही ब्रेक करना है. ओके, सो देयर इज अ
Yes.
क्वेश्चन फ्रॉम ऑडियंस. शैल आई आस्क?
Yes. Yes. Yes.
Yes, there's a question. What would be few must do's and don'ts as a homeopathic student?
Okay. As a student, I will first go for do's. Students should always focus on theory. What happens is they are confused. As a student, their main motivation should be to gather knowledge. Knowledge is theory. You are going to gather practical knowledge after going to your own clinic. But as a student, you should have a strong base of theory. You should read lots and lots of books. This is do's. And for don'ts, you should not get confused about joining different means. Many students, they want to do homeopathic practice, they then join ICU, they then they assist some uh, neurosurgery or cardiac surgery, and they learn something which they are not going to apply. They are not going to OT assistant in clinic. Learn which is applicable in your clinic. Read your books and then attend the homeopathy clinics.
Okay. What are the don'ts which students should avoid, homeopathic students?
This I have many times that many students underestimate themselves. They underestimate that their complaint is that they are not taught so much good in their college, or teachers are not teaching them good. See, don't blame others. Teachers are just facilitate you. You should learn. You are having books. You should learn from the books. And there is also one common complaint that we are not getting exposure of homeopathic doctors. See, you should not blame others, and having a mentor in homeopathy is great, but many times you do not get mentor in homeopathy too. You should be your own mentor. Your patients are your mentors. Treat your patients. Don't underestimate yourself. You can do everything. The problem is you underestimate yourself. I want to tell this point that whenever we see a successful homeopathic doctor or successful author, the point is not that they are extraordinary in their field. Many of the audiences, many of the students, they are more genius than the famous teachers and authors. The problem is that the uh, other doctors do not try it out. They don't write books. They don't teach. They don't go in front of camera because they hesitate. They self-doubt. They think that what will happen if they fail, what others will say about them. So they don't give a thought. And there is one thing, procrastination, prolonging things, that I'm going to write books on homeopathy, but we will do it afterwards, and that time never comes. My message to everyone is just start doing things. Don't wait that you will be good in skill and then you will start. No, just start it before you are good at that particular skill. Just start it. Whenever you will do it, you will gather the skill. But many authors, many good speakers, they don't come in surface because they don't try it.
Very true. My next question was some students, they want to start their practice immediately after internship, but they have a self doubt and the doubt is about so many complex theories. There are a lot of schools of homeopathy. So what is your count in that?
See, this is nice question. I wanted to emphasize on this point. I have seen many students in homeopathy. They love homeopathy. They want to practice homeopathy, but they are having doubt that whether they will be able to practice it, because when they see the seminars, when they attend seminars, when they watch the webinars, there are many different schools of thought, many complex case taking methods, and the remedies which are found in that case, these are also many times very rare medicines, maybe some rare. We are not, the students are so much confused that they have not heard of that name of medicine too, and then they get fear that whether they will be able to do it in their practice. But my message is, homeopathy is very simple. It is not hard at all. You just have to start your practice, and whenever, even if you will attend clinics of different famous homeopaths or mentors, you are always an observer. You are not in control of the situation. See, if you will sit in a passenger seat of car, and even if you travel for 1,000 miles, it doesn't count. You have to drive the car. Patient, you should see your patients. Patients should ask you, why I am not getting results. I am taking treatment since months, why I am not getting results. Then you will read, you will experiment, you will give results, and this is the real experience. So just start your practice. Don't worry. You will be successful in your practice, and you can always ask people. You send me message, I will tell you analysis and name which I understand.
Hello, Dr. Satyajit Kuchar.
Very good afternoon. I didn't want to interrupt his flow. Very good afternoon, Dr. Anand. Very good afternoon, sir, and wish you a belated
Good
happy
afternoon.
birthday.
Thank you. Thank you.
So you were answering that question. Please continue.
No. Any question for Dr. Rohit Deshpande? Because we are here for casual talk and we are not going to leave him, because he's here for the
Yes.
first time in a live. So he's trapped, I must say.
As uh, a very interesting question which you were talking about, the different approaches, the confusion that students face, and uh, the lack of confidence. Like many students want to start their practice immediately after internship, but they are confused. Which approach to follow? They don't have the confidence because they say that we have not seen many patients in our college, or we have not been exposed to various styles of practice. This is. Can you continue with that answer? Can you throw more light? And one thing which I have seen, like as I am also an author, like what we one thing is about how we represent ourselves in society. Uh, as authors, we become popular among students and among the homeopathic fraternity. But the very common patient that comes to us, he is least bothered. आप एक किताब लिखो, आप एक किताब लिखो, 10 लिखो, 100 लिखो, he's least bothered. And max to max, if I if I keep my book in the bookshelf, or if I make a poster of that and keep it in the waiting room, some patients will ask, अरे वाह तुम्हें book ले ले, oh अच्छा डॉक्टर साहब आपने book लिखी, अच्छा बढ़िया बढ़िया. कोई एक पेशेंट बोलेगा कि हमको भाई ठीक है हमें भी दीजिए पढ़ने, but hardly that common. And it is, and one more thing I've been doing, I've been writing articles in various journals. Like even if I post that, if I post the screenshot of the index page, and on the social media, besides some likes and comments, you cannot expect anything. Like if I post a before and after pic, at least some patients will ask, at least some word of mouth referrals will come. So how difficult do you find to maintain two parallel tracks as an author and as a practitioner? Because we know that once I was listening to an interview by the great Gulzar Sahab. He also said that भाई किताबें लिखने से रोजी रोटी तो आज भी नहीं चलती किसी राइटर की, और and being an author on the contrary, because people are very judgmental, भाई even our fraternity becomes judgmental, भाई इतना टाइम मिल जाता है इतनी बिजी प्रैक्टिस से, फिर इतना
Practice
टाइम
नहीं
मिल जाता है
करती
तो
होगी,
शायद
practice
प्रैक्टिस नहीं
नहीं
चलती
करती
होगी.
होगी.
I didn't
I
want to get
I
I
I
didn't
get
want to get that harsh.
this.
And you also, and at a point of time a writer may also may be influenced by such negativity, that why do I sometimes uh, and the more we go into theory, sometimes it may happen that people may start having very high expectations, like now they don't want medicines from you, they want magic pills from you, since this is one such. And how difficult is it to maintain two parallel tracks, since we know that, like when you write in any journal, be it a peer reviewed journal, whether it is a peer reviewed journal or it isn't, authors don't get a single penny. Authors don't get a single penny. On the contrary, we have to pay the publication fees to certain journals because they say that we don't advertise. It is only the authors from which we make money, and we utilize it in printing and like all that. So how difficult is it to maintain two parallel tracks, that of an author and a practitioner?
Over to you, Dr. Rohit. Please answer, boss.
Yes.
Over to you, Dr. Rohit.
See,
Please answer, boss.
see, these two are totally different things. Patients are not at all bothered about
Don't mention.
whether you are an author or you have written 10 books or 5 books. They are not bothered. They need results. So
So your voice is still breaking, I guess.
which one should have is giving results. Okay, am I audible now?
Yes.
Yes.
Hello, am I audible now? See, the main USP of any doctor to have a successful practice is results. He should give
Exactly.
results. Patients are not bothered whether you are author or famous or anything. They don't see how much followers you have on Instagram or YouTube. They want results, and we should focus on results as a doctor. Now I will talk about the what people think when you are making reels or you are writing books. Some people criticize that you are having so much time after clean that you must not be a busy practitioner. But good example with us, Dr. Adil Chimthanwala sir, is very busy
Yes.
in practice. Then also he makes videos, he writes books. See, people
Yes.
will say anything. We need to ignore people.
Exactly. Exactly. And one thing I wish to add.
Otherwise, we will
Uh,
be so busy that we will not be active on social media at all.
exactly. Exactly.
I get to hear a lot that I've been dancing on Instagram, how my clinic is going on, how I'm taking to my bread and butter. They don't know that I get up 5:30 in the morning, and even their messengers, their spirits will be sleeping that time. At time I leave the bed 5:30 in the morning, and I hit the court. And what is my schedule? So this example of Dr. Adil Chimthanwala has
Yes.
touched me, boss. Seriously.
Yes.
It will keep
And
me
even in
going.
past, and even in the past, all great practitioners were many great practitioners were many great authors. Dr. Borick, Dr. Farrington, Dr. Kent, great doctors also were great authors. It is because what they experienced in their practice, what they realized, what they learned, what they uh, like, what they came across, they could pen down, and those books have become immortal classics in homeopathy.
Very true. Very true. That's very true.
So your voice is inaudible again.
Yes. If at that time there there would have been Instagram, then these author would also we would have also seen these authors making reels. If Instagram was present at that era, use of these authors too. Am I audible?
Yes, yes, most likely, yes, we might have seen them also.
Yes. We are just trying to comprehend. Being a good homeopath, we are just, joining the bits of the words and getting the meaning of it.
And I have one more question, Doctor.
Yes, please.
Dr. Rohit, does being a very good actor help in case taking? Does being a very good actor help in
Okay,
case
am I
taking? Because you
audible
know how
now?
a patient is pretending. Yes, yes, you are audible now. Uh, because being a very good actor, you know how to uh, because you know the nuances of voice modulation, you know the nuances of facial expressions. So does being a good actor help in good case taking?
Yes, yes.
Why is it happening when Dr. Deshpande is speaking? We are not able to
See,
listen anything.
what I
Just the
think is
message
in
coming.
my practice, I focus on pathology. In my practice, I focus on pathology, and in pathology, we do not need to analyze much. See, if it is left side pus, abscess, it,
The आवाज पुन्हा पुन्हा
am I
जातोय. Your
audible?
voice is like uh, yes, now you're audible.
I want to say that acting doesn't actually help in case taking. My focus in practice pathology, and in pathology we do not need to analyze much. It is crystal clear. Am I audible now?
Yes,
Yes,
yes, you're
but
audible now.
lagging, a little bit
There is
lagging.
some network connection problem.
Okay, okay. Are you good at acting, Dr. Kuchar?
I don't know.
Open.
I don't know. I
Audible
guess
now?
I'll make some reels and let the Insta public decide.
I use my acting skills in case taking, and I'm getting a lot of benefit of it. I become autistic in front
See,
of
now
autistic child.
now am I audible?
Uh,
Being an actor doesn't really
yes, you're audible now, sir. Yes, unfortunately, it's happening. When we are speaking, the voice is not breaking. When sir is speaking, the voice is breaking.
I think it's a good.
So I was saying the same that if the person is introvert, reserved, I behave the same. If the person is chirpy, I
Same.
behave the same, just to match the vibe with the patient because he needs to speak up. I would like to tell
Yes.
you one case, one very small little case.
See,
Last
I
week,
want
I
to
get a case of
emphasize
molluscum
that
contagiosum,
practice. I give
and
more
the
emphasis
boy
on
was of
pathology.
11-year-old, and he was not ready to speak at all. And I tried remedy like Silicia, Calcarea carb, and it's been 3 weeks. He was not speaking up from his mouth. He just coming, sitting, removing the cap, showing the molluscum, and it's the same. Then I asked his parents to please, give some privacy. Then I asked him, what is that? What happened? And I spoke to him. And I found something is wrong, with the kid because he's not speaking anything. I started asking leading questions because I want him to open up. As soon as I spoke about the parents, he started crying. Okay. Then I got to know that there's something sensitivity regarding the parents. Then I told him my stories, how my childhood was and all. And then he started crying like anything.
2 मिनिट फोनवर केस घेणं सुरू आहे. फोनवर केस घेणं सुरू आहे.
And later I
नाही,
realized
वेळ नाही, 5 मिनिट.
it is a case of a child abuse, and that too by parents. So they make him work like anything. The parents fight at all. There was an involvement of one uncle. So he was abused by that uncle by every mean. Then I realized that he is not calcarea, he's not silicia. That's why my medicine is not working. I gave him 1 dose of carcinosin 1 mg. And next 15 days when he came to me, apart from the molluscum, he spoke up. The 11-year-old kid, he said that I'm ready to fight. I need help. So it is very important to act the same way the patient is behaving with us, because the comfort zone is all matters if you want patient to open up.
And one thing which I like, and being a good actor, like, though we need to be very transparent and very honest in practice, sometimes we have to be diplomatic and be actors in a sense that, like, sometimes when I substitute my father in his clinic, like, many patients say, Doctor Saab ne di thi na, wahi dawai dena. Now I know that the picture is different, and I need to change the medicine. So I need to be a good actor so that my voice modulation, my facial expression, my body language it should be it should be such that the patient should be convinced that I have continued the same medicine. Sometimes even for
Yes.
the good you have to lie. बोले ना वो झूठ जिससे किसी की भलाई हो वो झूठ नहीं होता. So sometimes you need to I'm not saying that we need to deceive the patient. I'm not saying that we should give any false assurance. But sometimes some of the irrational and the stupid notions that the patient like holds in his mind, to deal with that, you need to be a good actor. Sometimes. फिर हमने तो सुना था वो ऐसे ही फिर वही मेथड से करना पड़ता है, फिर ऐसे हाँ फिर वैसे ही किया. Sometimes to gain the confidence, and yes, and that only can be sustained only with results and nothing else. Just as Dr. Rohit sir said.
Dr. Rohit, can you tell what is the most important that you see in your case? Oh my God.
Yes. The which audible now? I think I'm. I think it is of prime importance. Am I audible?
सर आवाज ना राहून राहून येतोय, राहून राहून चालला जातो. काय माहिती काय होतं.
मला तो येत नाहीये. काहीच करायचंय.
काय करायचं.
मी हळूहळू शिकतो. डोंट
शिकताय
लाफ.
ना मराठी ऍक्च्युअली. नाही नाही नाही, ओ सॉरी सॉरी,
One minute,
नाही
I will.
बट पण ऍक्च्युअली गोड वाटते तुमच्या तोंडून मराठी, छान वाटतं.
मी शिकते हळूहळू.
हळूहळू. असं फोन डेटा वापरला तर फोन डेटा वापरून पण ब्रेक
Am I
होतोय का
audible?
आवाज?
Yes, but it's
Yes,
breaking.
you're audible, yeah, but it's cracking, voice is cracking.
And when you're giving answer, it is completely gone.
Completely gone.
I would like to answer one question, Dr. Kuchar, if you don't mind.
Yes, yes, absolutely.
What message you want to give to the students here, beginners?
Students, yes. I wanted to have my take on the do's and don'ts. First of all, one question that you always ask: have you landed up in homeopathy by choice or by chance? So, accept whatever you have landed it by choice or by chance. Now analyze. Now you are going to pursue with the same course, right? Now analyze and start from that very moment. Like, see whether you are डे बाय डे आप होम्योपैथ बनते ही चले जाओगे या आप एक ऑड मैन आउट ही रहोगे. यू ट्राई टू एनालाइज, यू ट्राई टू एसिमिलेट योरसेल्फ इन दैट, एंड समटाइम्स इट हैपेंस. डूज ऑब्वियसली अच्छे बच्चे जो होते हैं ना सारा पढ़ना ही है. डोंट, आई फर्स्ट टेल अबाउट द डोंट्स. डोंट वेस्ट टाइम. Don't waste time. Don't and stop comparing yourself with your engineer friends who have, like, after 4 years they might be start earning. Or don't compare yourself with your dentist or MBBS friends. Or stop comparing. Don't waste time. And what you have, do you analyze whether by choice or whether by chance. यहाँ से आगे क्या? तो ऐसा तो नहीं ना कि आप कोई 1 साल करोगे BHMS का, फिर कोई और कोर्स परस्यू करोगे. आपने BHMS ही करना है, और आपने 5 साल की जर्नी के बाद भी आपने यही डिसाइड किया कि मुझे होम्योपैथी करनी ही नहीं है, मैं अपने क्लिनिक में एक ग्लोब्यूल भी नहीं रखूंगा. अगर अनफॉर्चुनेटली आपने ये भी डिसाइड किया है, तो आपको एक अच्छा एलोपैथ बनने के लिए भी तो थ्योरी का नॉलेज लेना पड़ेगा, जैसे सर ने कहा. इवन टू बी अ गुड एलोपैथ, इवन टू बी अ गुड जनरल प्रैक्टिशनर, आपने ये कहना बहुत आसान होता है हमारे लिए कि जो सीखा है वही करो. अल्टीमेटली जो सीखा है वही करोगे तो सबके लिए अच्छा है. आपके लिए अच्छा है, सोसाइटी के लिए अच्छा है, सोसाइटी में जो होम्योपैथी की रिप्रेजेंटेशन होती है उसके लिए अच्छा है. लेकिन समटाइम्स इट हैपेंस, everyone is not well placed financially. The father is going to retire in few years and he expects you to become an earning person as early as possible. So it is not always easy for everyone. And I'll just give my example. My father, my grandfather, my uncle, my aunt, all these are homeopaths. uh, in one post you had mentioned that if someone is mentioning that someone is seeing 40 patients a day right from their very first day of practice, either that person is lying or he or she is born with a silver spoon.
My
So from
God,
my
this is
example,
the whole statement of the article.
from my own example, I tell you that कुछ चीजें तो है जो प्लेटर में परोसी जाती है. So because my father is a well established homeopath, he sponsored, ये आपका क्लिनिक है, ये जगह खरीद के दी, ये इंटीरियर भी उसका करके दिया. इट्स अ वेल फर्निश्ड क्लिनिक. ये आपका बर्थडे गिफ्ट है. You don't have to you don't have to you don't I don't have to pay any rent for that. अब जो कार जो मेरे पापा यूज करते हैं, दिस इज द कीज ऑफ द कार, यू कैन यूज इट. मेरे लिए एसी चेंबर और कार मेरे लिए रेडी है. आणि मराठीमध्ये म्हणतात ना, इतकं सगळं काही आहे, आता मी पुढे काय दिवे लावतो. अब ऋतिक रोशन के लिए पिक्चर प्रोड्यूस कर दी पापा ने. ऋतिक रोशन एक्टिंग कैसा करता है ये ऋतिक रोशन के ऊपर है. तो देयर आर some, yes, you may call me a person who is born with a silver spoon. कुछ चीजें तो प्लेटर में परोस के दी गई है, लेकिन केक वॉक तो फिर भी नहीं है. बिकॉज एक बेंचमार्क सेट किया है. तो पापा तो दिन में इतने पेशेंट्स देखते हैं, पापा का तो हमने इतना नाम सुना है. अब because some things become very easy, some things become very difficult. So I also try to analyze in an unbiased way what a person might be going through who has zero background in homeopathy or who has zero medical background, what financial difficulties he might be going through, or what uh, difficulties regarding the mentorship or what he might be going through. Yes, first do is analyze yourself, whether you have come by choice or by chance, or but gain knowledge, whether you want to practice homeopathy or not, and be very unbiased learner. And one thing that I have of late, like, जिंदगी भर इंसान स्टूडेंट होता है ना. मैंने राजीव दीक्षित जी के एक इसमें पढ़ा था कि जिस ज्ञान का जीवन भर इस्तेमाल करना हो उसे दोहराते रहना चाहिए. Like keep reading, like even after in your practice, like keep reading and utilize your 5 years to the fullest. The difference between successful people and unsuccessful people, out of many differences, is one difference is that they utilize their resources very well as compared to others. So it is very easy to grumble. Yes, there are many colleges who have many problems regarding the teaching, regarding the pay scales of teachers. Yes, we have to face those problems and overcome those, because we simply can't keep grumbling, because grumbling will not help grow our future. So this is, so I think I took a lot of time. I think the time belongs to others also, and mainly to Dr. Rohit sir. So I think I should, uh,
Thank you
mainly
so
we are
much.
here to listen, Dr. Rohit.
Thank you so much. Till then, we meet
Thank
again.
you, thank you.
Thank you
And
so
thank you, Dr. Rohit sir and Dr. Anand.
Thank
Thank
you,
you.
thank you so
And sorry, because I am a talkative person. I'm really sorry if
much.
I've taken more of your time. But the time belongs to you, and we are here to listen to you now. Thank you so much.
No problem. No problem. Am I audible, Dr. Deshpande?
Uh, तुम्ही एक काम करा ना डॉक्टर अनम, एक काम करा ना, मला डिस्कनेक्ट करा. आता मी फक्त तुम्हा दोघांना ऐकतो.
मी
Like you can disconnect me. I'll just listen to both of you now.
मी नहीं कर सकते.
And one more, like you can see the patients in the waiting room.
Yeah.
Yeah. So I need to exit for that also.
Please, you leave it. You leave it. I cannot discuss. I cannot. Yeah, do that.
Okay, I'll leave it.
Yes.
Thank you so much, sir. Thank you,
So
doctor.
thank you. There's a cross there. Yes. Am I audible, Dr. Deshpande?
Yes.
Okay. So my next question to you is: you have already published 4 books.
Yes.
What is your journey ahead in this? What next?
I'm going to write many books in homeopathy. Medicine books on bachelor remedies, 12 tissue remedies, surgery therapies, medicine therapies, many. I think more than 30 books are pending. The list is long. So let's see.
That's really a huge number, and I really, wish you all the best for your future ventures and whatever books you are writing. But I have one regret. The regret of not getting your books in my 3rd year. If I would have got these books in my 3rd year, definitely my exams, would be much more easier. If you would have published it, couple of years back.
Actually, I have same regret. I wanted these books as a student for me also when I was in 3rd year.
Okay. Okay. My next question is: do you have any medical background in your profession, or you are the first doctor in family?
I'm the first doctor in family. I don't have any medical background.
So you are not born with the silver spoon.
No, I created it.
Oh, that's very inspiring. That's very inspiring. My next question is, am I audible, sir? My next question is, what message you want to give to homeopathic students?
It is not audible for me.
I said my next question is, what message you want to give to homeopathic students?
Yes. I want to tell everyone that believe in yourself. Don't self doubt. Many times the skills you are having, even your family doesn't know or doesn't believe in you. Friends believe in you. You should believe in you. If you want to become a good doctor, a good author, or a good speaker, yourself. Work hard on it. Try it. Just start it. Don't fear failure. What people will say, critics will say, what will happen, you will fail in it. Don't bother about it. Just do it. Just start. You will be more successful than it.
That's very true. There's one question from the audience. Do you have any tips for AIPGT exams or students, those who are preparing for it?
Honestly speaking, I have no idea about it.
Oh, I have made one video on it, is available on Instagram, how to prepare for IGPT, and we have conducted 2 other guest talks also, so you can refer from that also. There's a question from where we can buy your all books. You can buy from Amazon or you can connect to Homeopathic Junction, Dr. Vaibhav Jain, and you can get your books at your doorstep. Is that okay?
Yes.
At the end of the session, I'll be giving you all the details in my story, how to get Dr.
Yes.
Deshpande's all
Yes.
books. Okay, my last question is, tell me your experience, for coming live for the first time and here with us, Homeopathy Heals.
It's a really nice experience, but these technical problems of connection, if it would have not been there, then it would have been more interesting.
Definitely, there were some network issues, some technical errors. That's okay. In the next live, we'll make it up. Okay, thank you so much, Dr. Deshpande, for being here, a part of being a guest of Guest Talk with Homeopathy Heals. And again, belated very, very, very happy birthday. And it's our privilege that you spared your time. And we are looking forward for your next 30 books. So I wish whenever I go to my school or my college library, they must be full of your books and your name will be all over, all
Yeah.
across the library. So very well, very, very good wishes to you. Thank you so much for being here. And I'll be posting regarding all the books and information how you can in my story. So stay tuned. We'll be back with another live very soon. Till then, stay fit, stay healthy. Homeopathy Heals.